Inside Now with Dr. Angie, a show about health. Starring Dr. Angie Sadeghi and featuring Carolina Schneider. You're going to want to loosen up those pants on this episode. It's all about bloating. Go on with the show.
Welcome to Inside and Out with Dr. Angie, a show about health. Today we have a very exciting topic. We know you're going to love this. Bloating. Dr. Angie, I don't even know where to start, but there's just so many myths and misinformation about bloating out there. You know, people are on Dr. Google trying to find out why they're feeling bloated. Before we start, I just wanted to ask you, I get a lot of people saying, well, when I chew gum, I get bloated because I'm swallowing air. Okay, let's try for a second to swallow air. Let's see how successful that will be. Ready? 1, 2, 3. It went into my lungs, I have to say. It didn't go into my GI tract. I exhaled it right away, didn't I?
Alright, that's definitely a myth.
Yeah, with all seriousness, there are about, generally speaking, 3 types of bloating, okay? The first type of bloating is that physical distension, okay? So like, for example, imagine you just had a large meal, okay? If you eat this huge plate of food, it has to fit somewhere, and it goes into your stomach, and your stomach is normally closed up, and it gets bigger to fit that food in there. So you get a tiny bit of physical distension. So now let's imagine you are very constipated, right? What does that mean? The entire colon, the ascending colon, transverse colon, the descending colon, and rectum is full of poop, okay?
You're just full of poop.
FOP. So that gives you a bit of a physical distension, and you know, of course, that's normal. So what do you want to do? Improve your motility by eating what?
Fiber.
Our favorite food.
Our best friends. Yes,
Our best
definitely incorporating fiber into your diet so you have better gut motility. You're going to the bathroom regularly, whatever's normal for you, to fix constipation. So at the end of the day, it's the constipation, not, let's say, the bloating.
Exactly.
Perfect.
So another type of physical distension is weight gain and obesity. So this happens a lot where people go, in the last year I've gained about 20-30 pounds and I just feel so bloated. Well, I believe you. When you gain weight, you know, what happens sometimes is you get a ton of, you know, that fat that goes inside the belly, around the organs and into the liver that's linked to heart disease and diabetes and all kinds of bad things. It's called visceral fat or mesenteric fat. That kind of fat is bad. It makes you look pregnant. That's one bad thing, but also gives you disease, okay? So it causes a lot of bloating, especially after you eat, because your belly gets that physical distension on top of that mesenteric fat distension. So most of my patients who complain about bloating, actually that's what they have. Not to be confused with that subcutaneous fat. That type of fat is that pinchable fat. Like, we all have a little bit of it, and so it's not a big deal. We all get a little bit of that, especially when we gain weight. And so that can cause bloating too. Okay, this is important. So I had a 60-some-year-old female who came to me, and this was during the pandemic, and I was actually seeing her on a virtual visit, and she said, I have so much bloating, and I couldn't examine her, but she was saying that I'm just super bloated. So in that age group, one of the things you want to think about is malignancy, right? So she ended up having a cancer in her belly that was causing the bloating, right? And she was also a little gassy, but anyway, nevertheless, it's very important to not say, oh, it's just what I'm eating, right? You have to rule out some of these important things that can kill you. If you've ever been pregnant, okay, you can have weakened muscles. So that physical distension that you get from a little bit of constipation or from eating a little bit can look worse than it really is, because the muscles are weak, so you can get your bowels sticking out a little bit, and that can give you a little bit more of a physical distension. So anyway, those are some of the common reasons for that kind of bloating.
Got it. Thank you so much for explaining. I think these are things a lot of people can relate, you know, weight gain or being pregnant or being constipated, and they may be jumping to conclusions when it comes to their bloating. So how about gas? You know, if people are gassy or if they have a lot lactose intolerance, that they're not digesting lactose properly, Can that also cause some bloating?
100%. Thank you for bringing that up. So gas and bloating, meaning the type of bloating that's caused by gas production, comes from the gut microbiome metabolizing the food that you're eating and fermenting that food and producing gas. It could be methane gas, which is that smelly gas, or it could be hydrogen gas, different types of gas, right? And so that can cause a temporary distension because the bowels balloon out, and sometimes you belch it out or burp it out, and you pass the gas from down below or flatulence, and it gets better, and that tends to come and go. But one of the common reasons is lactose intolerance. So after age 5, you lose the ability to break down cow's milk usually, and or your mother's milk too. And so it's kind of weird that we drink a baby calf's growth fluid, and so what happens is that lactose sugar goes into the gut. It doesn't get digested very well. It's called maldigestion, and it produces a ton of gas and bloating. Okay, so that's if you're eating dairy. Other types of gas and bloating is from, say, you have celiac disease and things are not getting digested well. That could cause it. One of the most common ones I see is gastroesophageal reflux disease, or conditions where you have a lot of acid production.
Okay, interesting.
Yeah, so what happens is the acid is getting produced in your stomach, and it kind of travels through the gut into the small intestine, and the small intestine usually has an alkaline condition because the pancreatic enzymes love alkalinity. Okay, so now you have all this acid that travels down into the duodenum and takes these pancreatic enzymes and chops them up and basically disables them and makes them ineffective. So then you have a little bit of fat maldigestion because the pancreatic juices really help with fat digestion. So anyway, that could cause gas and bloating as well. But when you go on medications like proton pump inhibitors, like H2 blockers like Pepcid or famotidine, or medications like Prilosec or Meprazole, things like that, suddenly you get better. So, and a lot of people don't have acid reflux, they just have bloating. So it can be very difficult to diagnose. Perfect. All right, I know this is a lot, but there's also...
I want to ask you about one very popular topic now, SIBO.
Yes.
Please talk about that and bloating, because we see people out there and they say, oh, I get so bloated. I'm bloated all day, no matter like if I ate or not. I'm always bloated, and it looks like I'm 6 months pregnant. Dr. Google, what do I have? You have SIBO. So can you tell us about that?
Yeah, I think that when you type bloating, there probably a couple of the first couple of things that pop up is SIBO, and I think that could partially be industry driven, because you could sell a lot of cleanses, you could sell a lot of fat diets, and all kinds of sorts of supplements to people, and it's a really easy catch or a trap for patients, But SIBO is not as common as you would think. It's called small intestinal bacterial overgrowth, and I think it's way overdiagnosed, right? Or small intestinal fungal overgrowth. So what happens is basically there's an overgrowth of bacteria in the gut, and it's not supposed to be the way, there's not supposed to be an overgrowth, and when there is, when you eat food, that food gets fermented by the bacteria and produces more gas than normally because of the overpopulation of the organisms in the gut. So it's way overdiagnosed, and unfortunately, people are being sold all kinds of diets and supplements and cleanses and starvation diets. I mean, it's just so common, and so many different supplements to kill the SIBO, and then take the probiotics to replenish the gut microbiome, and then oh my gosh, it's like a huge industry, and people are getting ripped off, and they go through antibiotics, 3-4 rounds of antibiotics, and they still don't get better. And most of the time it's because, it's a very difficult diagnosis to make, and we don't have good tests for it, right? The breath tests are not that great. The poop tests are definitely not good and actually useless, right? So number one, it's hard to diagnose. Number two, we don't have treatments for it that have been scientifically proven to work. So anyone comes up with a treatment, and it gives people high hopes that, oh, this is it, this is gonna work, right? And unfortunately, it doesn't work that way, because you could kill off the microbiome over and over again, and if you're not addressing the underlying cause, it's going to come back.
All right, so the last one, I think you said you had one more type of bloating.
Yes.
And that is
functional bloating.
All right.
Very good. You were paying attention, Carolina. I think that is probably my favorite one to talk about, because IBS is very commonly associated with bloating. And it's a functional bloating. And so when they did studies where they took normal individuals, normal meaning they don't have IBS, and people with IBS, and they insufflated their colon with a little tube, they stuck a little tube in their colon and they put air in there, right? So people without IBS were fine, and they were like, okay, so whatever, you know, so there's like a little bit of air in there. But people with IBS had tremendous discomfort and felt very much bloated, whereas the other people did not feel so bloated. So there's something functional, nervous system related, where the tolerability for gas and bloating differs from individuals. And if you have IBS, it's no wonder that you have a little bit more sensation. And so if you have IBS, the best treatment is to treat the IBS. And if you have IBS with constipation, the most important thing is to treat the motility and improve the motility of the gut. If you have IBS with diarrhea, it's important to basically use medications that subside the nervous system's irritability, right? So, or you know, if the nervous system is uncomfortable, you help actually with medications called tricyclic antidepressants, which are not for depression, but to help with the nerve pain. So anyhow, the point is that, you know, you got to be careful what you believe when you read things on the internet, and it's not simple, and a lot of times even with the proper treatments you can still have bloating, and but the gimmicks are not going to work, so you have to be careful. But lifestyle is key, and I want to turn it to you. What do you suggest to your patients with bloating?
Absolutely. So just to emphasize, there are no foods that will de-bloat you. You know, some foods like ginger can help with nausea, but it doesn't mean it's going to make you less bloated. Why? Because at the end of the day, you need to address the root cause, right? Like as I said, as we learned today, there's so many different causes for bloating, so it's making sure that you're addressing that first, and then of course a high fiber diet with, you know, proper hydration to ensure gut motility. If you're constipated, addressing that first. If you need to lose weight, addressing that first, and that's usually, you know, solves the bloating. But there's no magic pill or even foods that will make you less bloated, or teas. You know, there's so many de-bloating teas out there. But Dr. Angie, this was so informative. Thank you so much. I know, you know, we talked a little bit about lifestyle, so I wanted to mention I love your box with Daily Harvest. You created a high fiber, very nutritious box, and I think this is great for people who are trying to just eat better.
Absolutely, a healthy lifestyle.
I love it. Amazing. So thank you so much for joining us today. If you are interested in trying Dr. Angie's Daily Harvest box, we actually have $50 off the link you can click. Let us know if you have any questions, and we'll see you here next time on Inside and Out with Dr. Angie.